Pleasure
Very
to see
good.
you.
You can see me now?
Yes, I can see you.
Excellent. I can see you as well.
Okay, let me just put my phone on the support. So, how's
Okay,
going in
just a
Australia?
sec.
It's winter. It's winter time.
It's winter time, but it's really not so bad. Really not so bad. The weather's been glorious, as we've been having the best weather. You know, someone's looking after us.
Great. And how's it going with the lockdown? I mean, I'm sick and tired speaking all the time about the lockdown, the COVID.
Yes.
But yeah, you said to
Well,
me
look.
last time something very nice. Yes.
Well, no, what I'm saying, we go into this we go into this cocoon, but I think we're all gonna surface out of this like butterflies. I think we're all gonna come back feeling fresh. We have lots of great ideas. We're gonna have so much more energy to help our clients to really blossom and to help them with their skin. I mean, we are staying in contact with all our clients through Skin Access and through, we contact our patients on a regular basis, and that's been a blessing to have Skin Access because we could talk to them about their skin, we can assess them, we can see their photos and etc. So no, look, I think, I mean, out of everything that happens in life, something good and positive comes out of it. And I think this has always been my philosophy. I think when I wake up every morning, I say, something's good's gonna happen today. And I think something's good gonna happen out of this lockdown. And I think we're all gonna be just different people in a way. We're going to focus on the good things in life rather than on the unimportant stuff. And I think we're going to be better practitioners for our clients.
Yes, many things will change, and the big change when we see as Universe Skin is we are very happy to have created Skin Access. Just to explain for the people that are listening to us, Skin Access is a teledermatology platform where you can connect with your doctor in distance, fill a questionnaire. Joesph, he will receive your questionnaire,
Yes, yes, yes.
and he will have all your information. He will go through image analysis also, because we have also connect all this data, so there is algorithms behind where they can check all the available database of all doctors using Skin Access Universe Skin. So actually it's working more like a community platform.
Yes.
And I mean, just we can explain what happened
Well,
afterwards.
look,
You
I
fill your
mean,
questionnaire.
I've already had Skin Access under the bio of All Saints Clinic page, but also I will be putting it on both my page, Dr. Joesph Hkein, and the All Saints Clinic page, so people have access to it. And people have been enjoying this. What it actually is, it's a simple questionnaire that takes you through the many skin concerns that we can all have. So by you logging on to the Skin Access platform, you can answer these questions, and we can pretty much closely diagnose your skin with a condition. We still like to see the picture of the face just to actually understand, to make sure that everything matches. And then when we go back to work, of course, we can examine the face, which will give us this other dimension. But once we really have the diagnosis from Skin Access, we can tailor a solution to each client. No two people will get the same thing because no two people have the same problems or same lifestyle, or we're all different, we're all unique. And then we all have different desires, but our skin health is totally different from one to one. So this is an amazing opportunity for our clients worldwide to reach out and just say, hey, this is what my skin is doing right now, and what can I do? How can you help me to really get the optimum skin health possible that we can have it today? So this is
Yeah,
unique. There's nothing like it.
skin beauty is about skin health, firstly, and sometimes people we underestimate the strength of skincare because we are not consistent, which means we're changing all the time.
Exactly.
As I'm saying, there is 7 billion living in this earth, and everybody's using someone else cream. They will use
Yes.
the cream of the influencer. They will use the cream of Cosmopolitan magazine or whatever. I mean, we don't
Yes.
have to mention brands or magazines, but everybody's using someone else's cream, and this doesn't make sense. I mean, if you're consistent in skincare, if you have the right person, you delegate your skincare routine, it works and it can really deliver results.
Exactly. Look, exactly. And I always assimilate this to our skin is an organ, and it's the biggest organ in our body, and we all have certain condition in our skin. Even when your skin, you think that your skin is perfect. Like, I mean, I even surprised myself 3 years ago when I just sat under the Visia and then had 1 year of building double bay clinic, and I completely ignored my skin. So my skin changed drastically because I really neglected it. So when you see the diagnosis and you see what your skin happened to it, you can come up with specific. And I always say, imagine you go to the doctor and then the doctor gives you a blood pressure pill because your blood pressure is high, but you go home and you buy a diabetes pill. You buy a pill for diabetes and you take those pills because you have them at home already. What's that going to do to your blood pressure? Nothing. And the same with skin. The skin is unique and it's got conditions. And unless you treat the condition with the right solution, you're wasting your time, you're wasting your money, and then sometimes you're making your skin worse because this product can irritate your skin and it can make the condition worse. So I think sometimes it's wiser to get a diagnosis and then treat the condition according to the diagnosis with the right ingredient, the purest ingredient, the best ingredient that you can get, so you can really win and win fast, not in 3 years, not in 6 years. I want my client to really get results within the first week, to if it's just hydration, or a couple of weeks if it's redness, or 6 weeks onwards if it's pigmentation. So, and I feel with Universe Skin, I can do that for them. And this is why I always get excited talking about skincare, because you can change so much if you know what you're doing.
But this is our philosophy, Joesph. You know that I'm part of Universe Skin as leading the company, but at the same time, I'm a scientist. I'm a PhD in cutaneous pharmacology. And this company were motivated by clinical evidence. And one part of the clinical evidence is to say that there is no skin that looks alike. Even twin sisters, we are different because we have different habits towards the sun, the lifestyle. So everybody is different. And the only person that see the people in their difference is the doctor. Of course, there are other specialties and professionals, but the doctors, they have a deep knowledge about tissues, about the skin, about how it works, and they see individuals. I mean, when you look at big companies, the manufacturing one product that has to be a blockbuster and sell it to as many people as possible. But at the beginning, when we started Universe Skin, we start like a community of doctors, but we were not happy with the existing offer. And it was too complicated to understand. So we try to deconstruct and reconstruct in order to make something that empower us to treat our patients the way we want, and not to give them 3-4 bottles, not to be sure what is on the bottle, how much, and how fresh it is.
Yes.
Because, yes.
And I admire that, because knowledge is important. And I think more and more people want to know what they're using on their skin. I think gone the days where people will accept something just because you say, hey, use this one and that's going to fix your skin. People are more intelligent now. And I think people deserve to know what they're using. And I think this is a wonderful solution that we can say, I am going to give you some salicylic acid with some, niacinamide or vitamin B3. So I can be specific, and then the patient can be educated along the way, because let's face it, 80% of really what we can achieve for patients is done at home. And so if they're going to be involved and they're going to create 80% of the results, they need to know. We need to inform the patients about what works and what doesn't work, and what we're going to do for them. So I like to get the patient involved in this process. We partners in this process. It's not just about me saying, take this and use it. It's a two-way process. So we discuss, we prescribe the right thing, but it's a unique. So whatever we're giving our client, it's just for them. So they cannot really go and just give it to the husband or give it to the daughter, because it's medicine. It's really medicine for your skin, but it's a medicine that can transform your skin and make you more beautiful.
Also in Australia, we have a possibility to compound concentrations, but they are not available in skincare, but can be only available dispensed by clinics. And this is also an important difference. Of course, when you go in very high concentrations, it might be more irritant, but if you have the right guidance, you can go up on the safe side. But this is very unique service we offer in Australia. We can go in concentrations, but they are not available in classical skincare products.
Correct.
And of course, to all the people who listen to us, wherever you are in Australia, in the world, you connect with Joesph, fill the questionnaire. You know, dermatology is everything about listening and looking. So if you let's say, answer the questionnaire. It's a dynamic questionnaire. It's smart. If you say I'm a man, and they will not ask you if you are pregnant. If you're a woman at 20 years old, even if it is your main concern, don't expect to ask you too much about wrinkles, because if you're 20, you don't have too much. So it's a smart questionnaire, and it helps the doctor to have a full dashboard. Actually, it's optimizing the lecture of the results. But still, Joesph, I know how serious you work with it, and his team also is an excellent team with very deep knowledge. And every patient fill the questionnaire. It's like being having even more time, because sometimes I know you have a time to look in all the cases during the night. I know you're working non-stop, and it's always better because you have more time to think, look at the photo, look to the questions, and you can provide more time. So this is the idea of Skin Access also, to make Universe Skin economic-wise available and accessible to everybody. And also enhance the doctor with the possibility to look in each patient case when they want, think about it, and interact with the patient.
Yes.
So we have a lot of questions today, Joesph. Let's start answering the question. Let's be more specific.
Hit me up.
Okay.
Tell me.
So one of the questions, the first questions, is about the hyaluronic acid. So
yes.
What is the results with the new hyaluronic acid serum?
Yes, one of my new favorite products. I'm using it myself right now. Well, look, why I like this hyaluronic acid, not because only it's a high quality of hyaluronic acid, but it's got two different molecules of hyaluronic acid. It's got the high weight molecular weight hyaluronic acid and low weight molecular acid, which means the hyaluronic acid, when you put it on your skin, it's going to hydrate your skin immediately, but also it's going to penetrate to the deeper layer and then really hydrate in a much deeper layer. So immediately you see that your skin becomes dewy and glowy straight away. You know, I mean, I'm amazed how quickly it really just leads the results. It's settled in the skin beautifully, but it's a product that you can really utilize in more than just a moisturizer, because yeah, I mean, if you want to give yourself even a deeper hydration, you can combine it with this straightforward pea serum. I call it a naked pea serum, because pea serum is an amazing product, and it does have about 0.2% of the hyaluronic acid, while the H has got 1.4. So you can increase the percentages to 1.6 of hyaluronic acid. And that's quite high, but it's a pure hyaluronic acid, so it does work really well. And then so you can do it as a mask. You can combine it with the O, the cleanser, which is a wonderful cleanser. O stands for basically olive oil. And then when you combine the two, you can just put it on your face as a mask, so it actually prolongs the effect of the hyaluronic acid on your face. But from my patients or clients that give me some feedback, the majority of them are loving it before they put their makeup. They say once they put the H on their skin, the H serum on their skin become glowy and dewy, and then their makeup sits well for the rest of the day. So they don't have to really touch their makeup. And I think this is something I didn't know about the product, but this is some of the feedback that my female client has been just really coming to me, and they're equally in love with this product.
Yes, it can help also the lipstick. It can be used on the lips.
Exactly. And when you have dry lips, any dry skin really loves hyaluronic acid. As you know, hyaluronic acid is the biggest glycosaminoglycan in the skin, or the sugar in the skin is hyaluronic acid. So it's an abundant molecule in our body, and it drops down with age or under stress. So having that in a bottle is quite handy. And I love the bottle. I love the way you squeeze from the end and it gives you the drop. So it's a really cute little bottle. And, you know, I think it's probably one of my latest favorites.
We like little bottles. You know, a bottle that cannot enter in a small lady's bag is not a bottle that can be used.
And so it's so cute. I mean, it's only so tiny. Yeah, it's so tiny that you can carry it with you, really, whether or not you're a guy or a girl.
Yes, so you probably need to apply it once in a...
Yes.
This is what we like, small products, but we can be together with our patient 24 hours a day, 7 days a week. So if we go to hyaluronic acid more in the science inside it, you know, many people, they look skincare like it's a magic potion. There is no such a thing when you develop topical products. It's about science. And there is a scientific logic that everybody uses a lot of marketing over top to make the product looks like a miracle product. There is not such a miracle product. There is scientific logic to formulate the quality of ingredients you are using, how fresh you make it. So it's a little bit like cooking. There is hyaluronic acid. We use pharma grade hyaluronic acid, the same that is used in injectables. And of course, you can go for ingredients that cost 100 euro a kilo up to ingredients that cost 10,000 euro a kilo. So what makes the difference in the products is the quality of the ingredients, the origin of the ingredients, if it is pharma grade, if it is cosmetic grade, the purity.
Yes.
So it's about science. Actually, you always have a logical outcome. When it's about hyaluronic acid, is a key part of a skincare routine. Why? Because everybody using fibroblast boosters, products, molecules that will stimulate the fibroblast, like isoflavones, madecassosides, retinol. But this will boost the fibroblast to produce more collagen, more elastin, all the fibers that keeps the epiderm to the derm and make this elastic tissue that is the skin. Yeah. But the hyaluronic acid is different because hyaluronic acid, it is inside the skin, inside the extracellular matrix, where you have also swimming the fibroblast inside. The difference is that the hyaluronic acid is retaining the water. So it provides elasticity, but with a different mechanism of action. It doesn't make fibers. So this is the reason whatever is your skincare routine, hyaluronic acid is important to be part of it because it works in a unique way that no other molecule can provide. Yes, please.
I agree, and I usually just give my patients the analogy. I say, look, if you have a train, that the train needs to go from A to B, you need the track to be tight. And then the way we get that the track tight is to actually hydrate the skin with hyaluronic acid. Once that track is really nice and tight, the train can go from A to B. If the track is zigzag and it doesn't really sit together, the cells cannot function well. So they need the platform. The cells need that platform of hydration and the extracellular matrix for the cell to function better. And hyaluronic acid, like you said, is unique and it provides that hydration. So the cells start to function much better than what functioned before you use the product. So do yourself a favor and use it.
Exactly. And where we go in a hyaluronic acid serum, the choice of a hyaluronic acid serum, and here is rules of how to formulate or how to purchase the right product. Firstly, I see so many people say, I had a 3% hyaluronic acid, then I bought a 4, then I bought a 5. The percentage in the hyaluronic acid doesn't play such an important role because the most important is what is the molecular weight that the product has. So it means how big is the chain. So when you choose a hyaluronic acid serum, it's important to have 2 levels of chains, the big chains, but this stays on the surface of the skin. It restores the skin barrier. It is also a liaison, has a liaison effect. Even with a skincare you're going to put after, it will retain it better. Even with the makeup, it will be a very good primer. So this is skin barrier repair. And then you have the little chains, the little molecules, even no chain, just the little molecule, but this goes deep inside the skin. It penetrates very well. And it's also the big know-how about how you choose the molecular weight of your small hyaluronic acid. This goes deep and this works in the extracellular matrix. So it's important to have 2 molecular weights. 3 molecular weights doesn't make sense. There is very low molecular weight, go inside the skin, middle, average. There is no such a little, big, or small. We have no needle to bring the hyaluronic acid inside. What is big stays outside. So the skin is also a barrier. You have to know it. So what is big stays inside, and it has an effect on the reparation of the skin barrier. Is a moisturizing factor, so we'll keep all the moisture on the top of your skin. Second thing is very important to look for a formula that is synergistic, not just hyaluronic acid. And just to see if you have even 3% or 4%, finally everything stays on the top and you have a very sticky product. So I see many serums, they say 3%, you apply it and the product has so much big molecular weight, you see stick it. So actually it's too much of thing you don't need. Okay, you have a big number on the box, that makes you feel, oh, that's better, but it's not true. So not always more is better. So it depends on the molecular weight. Then look for a synergistic formula. And the synergistic formula means what? Means look for actives next to the hyaluronic acid, that it will have a good function to boost your dermis cells. So we use organic silica. We use a very special organic silica, which is a silica binding with a sugar to better penetrate inside the cells. It's a silanol, and this is also a very unique product that can work in the fibroblast. It's boosting the fibroblast. We use also a peptide, we are specialized of peptides, which is an inhibitor of the enzymes that destroy the hyaluronic acid we already have on the skin. Because we don't have to forget, we already have hyaluronic acid on the skin. With age, we don't produce enough, and we destroy more as well, especially in Australia with a lot of sun damages. You have, due to the sun damages, you have a lot of enzymes that start being crazy. They don't understand what is a damaged hyaluronic acid, and they start attacking the hyaluronic acid. So actually, you destroy, you make less, and you destroy more of what we have, because those enzymes, they get crazy. So actually, we have a peptide, which is an inhibitor of those enzymes that destroy the hyaluronic acid. So actually, it's not enough just to bring from outside, but you have to protect what is already inside.
What you have. That's a good philosophy always with skincare.
It's a very good formula. It works perfectly with the injections. It stops the injections in a great way. And of course, hyaluronic acid main functions, anti-inflammatory, repairing the skin barrier, and is also a dermis booster. So what to expect? Your skin will be repulped, your skin will be more tense. If you mix with a serum, your serum will become much more hydrating. Of course, you can combine it with Next Ultra O. And just I want to spend 1 minute to talk about the O. Next Ultra O is O like oil, and it's a universal cleanser. It's not just a de-makeup. So many people, they come to us and you see, why you make a cleanser that could be used also for a Greek salad? Because it has 70% of olive oil. And of course, many cleansers, oil cleansers, they say we have oils, vegetable oils, but they have just 3%, 10%, because it's very expensive to put a lot. And so why an oil cleanser? Why believe that the oil cleanser is the future? Because the habits has changed, which means more and more female, even male, they're using waterproof makeup, and also the sunscreens. The sunscreens, especially in Australia, everybody is very well educated to use sunscreens. They are all waterproof. So, and there is very good clinical trials. Even you can do it yourself, your practice. I know you did it already. You take someone that uses sunscreen. In the end of the day, you put a photo in Visia, the skin clean, and a photo with a sunscreen. And then you can see how your skin looks when it's completely clean, how it looks with the sunscreen. In Visia, you can really see the sunscreen of the skin. And then you ask them to clean with micellar water or with the Next Ultra O, and you put them again on the Visia. When you clean with the micellar water, half of the sunscreen is still on the face. And when you use the O, all of the sunscreen is gone. And it's the first thing you need to do when you're talking about pollution, about also all the pollutants, they are soluble in oil. They're not soluble in water. So the first anti-aging thing you do is skin cleaning. And especially if you use sunscreen, use an oil cleanser. Nothing else to clean your skin as well as an oil cleanser.
Exactly. Then oil removes oil.
Exactly. And then the olive oil has many benefits. It's antioxidant. It's also very good for the scalp because it contains phytosterols and little quantities of azelaic acid that boost the hair growth. It's very good for the irritated scalp to be used after PRP injections. Also for men, I'm doing very often seborrheic dermatitis of the scalp, but I saw so many female patients, they have thinning hair because they aggress the scalp actually. It's not only hormones. So you need to repair your scalp, and VO, it can be a great product. It can be used on the scalp. So actually it's a very economic product because you can clean your face, you can clean your eyes, you can use it as a mask if you mix it with the H. It makes a great mask. And it's pure olive oil, 70%. It has again the peptide. So, but especially if you're a sunscreen lover, you should be an O lover.
You need to use it. But also when you're doing the peel, when you do the Universe Skin home peel, when I use the O, you can really make the peel even more powerful for people that need to go that little bit extra and the strength of their peel.
Yes, and what is a good cleanser? Again, what is the standards for the cleanser? should be gentle to the skin, should not damage the skin barrier. So too much cleaning with aggressive product is not good neither. And the good thing with the oils, they can clean while they're repairing the skin barrier. And again, why olive oil? I mean, what was the reason I chose the olive oil is the story of the skin pH. So the skin pH should be acid, 5.5. And most of the cleansers, when they go to the skin, they change the pH. Even the one they say they don't do, they still do it. Yes, and the olive oil is the only oil that is acidic. You know, when you buy a high quality olive oil, you see, I mean, I know we have Lebanese roots, so you know how to choose olive oil. And you saw the acidity of olive oil is very important for the quality. So the olive oil is the only olive that is acid. And when you clean your face, you need to bring the pH of the skin an acidic value. Yes. So no other oil can do this. All the other oils, they leave an alkaline pH. So it's a basic.
We used to make olive oil. We also used to make cleanser from olive oil. All those years, my dad used to do it and his dad used to do it. So I'm glad to see that these really things that worked in the past are coming back. And then someone like yourself are really bringing them to the market.
Of course, there is a lot of technology behind, because it's not just we have specific. The product has no emulsifier, so it's a very high-tech product. But this is also the philosophy of Universe Skin. All this gold, we need to take what is the best of the past and reinvent it for the future. This is also a philosophy of personalization. Like before, we used to see our doctor, get a medication that was just for us, compound. So this is the idea. We have so many technologies today, but we can keep what is the best from the past. And, you know, it's also funny because from a philosophical point of view, when you look about what was the ordinary of the past is the luxury of today. In the past, if you want a juice, it could be only fresh juice. Now have a fresh juice is it's a luxury. I mean, if you want to have a dress, it could be only tailor-made, because now tailor-made is the ultimate luxury.
And this is how we describe Universe Skin to our client. It's just like, you know, we're giving you fresh orange juice. We're not really giving you juice that we squeezed 2 days ago and bottled it for you. We're giving you fresh orange juice just for you now.
So
what else are we talking about?
Yes, let's go for some other questions.
Sure.
What is the other questions we have? So, which ingredient is useful to treat open pores in the serum, in the actives used by Universe Skin?
Well, I mean, look, I also got sent that question myself, and I thought about it because open pores is not just a simple problem that you just you wake up one day and you have open pores. Open pores is something that can happen for many different reasons. The two common things that come to my mind when I talk about open pores is people that have very oily skin, like young people or people that have oily skin generally, and they're pouring oil all the time. The pore size are enlarged. And then so you can see them more. The other group of people is people when they go through the aging process, and then you start to lose the extracellular matrix component, or the collagen, elastin, some of the fat that supports it underneath it. And as you lose this volume, your skin collapses. And as your skin collapses, you start to see the pore because they stretch. And these two conditions, they're the spectrum, if you like. And then there's a lot of cases in between. So for people that have oily skin, obviously the easiest solution is to reduce the oil production. And what better product can we think of better than zinc? Zinc is the ideal product to really reduce the oil on your skin. It's also protective against sun damage. So that product immediately comes to my mind from Universe Skin. And then, you know, we have also the sunscreen that we use, also high in zinc. So, so this immediately comes to mind. So we do a serum with some zinc component, and also give them some sunscreen. The other extreme is when people going through the aging process, it's really bread and butter of what we do with Universe Skin protocol. So we need to look at the skin wholly, and then just not only look at the pore size. This is only one of the symptoms that the skin going through. We need to look at the quality of the skin. You know, is it a sensitive skin? Is it a skin that have a lot of oxidative changes because of sun or smoking or pollution? So we need to consider all these factors and then come to them with a routine, a cleanser with the oil, give them a serum, obviously prescriptive serum that they can use to treat all of their skin, not just the pores, because the pore will be fixed as part of that routine, and then give them the right moisturizer, whether or not it's the Next Ultra B1, 2, or 3, if it depends on their skin condition. And so it's not just a simple solution that I just give you one little wand and you just hit the wand and all of a sudden your pores are gone. Pores are just the symptoms of something else happening in your skin. So we use it as an opportunity to diagnose your skin and to come up with a solution. But yes, we can address pores in the skin. And I've seen it on many of our patients that we
works,
once you...
yes, it works in less than 2 weeks, the results of the pores with Universe Skin. And we have a lot of clinical evidence on this. So I fully agree with you. And one of the biggest mistake I see sometimes when I go to Sephora or to drugstores and I'm listening to the people that get advice, you see 55-year-old ladies going inside with very dry skin and say, I have an open pores, and they just give them a product with zinc or salicylic, which is a huge mistake, will make the skin even drier.
Yes,
and it's a very common mistake. I mean, even people have a basic knowledge about how to advise with skincare to not make these mistakes, but still it's so common. It's unbelievable to see how common is this mistake. And second is, yes?
Yeah. Go ahead.
And second is people, they really believe they have oily skin, but again, the skin oiliness, it depends of the season also. You might be very oily during the summer and less oily during the winter. With age, more you age, less oily you are. You become dry because it's also hormone related. Yeah. So, and really oily skin is the skin that cannot keep the makeup. The skin that the midday you have to make up. When you're oily on the cheeks, then you're oily. If you're oily on the T-zone, it's a normal skin. This is also a classical mistake. People say, I'm oily on the T-zone. This is normal. Everybody's oily on the T-zone.
Yes. Yeah, different type of skin. And I'm glad you pointed this out because people assume just because they have a oily nose that they have oily skin. But when you look at the rest of their face is really dry and dehydrated and struggling or compromised.
Exactly.
But so, look, in general, I think we just got to go back to basics. With any skin complaint that patient come to us with, let's go back to basic. Diagnose the skin. This is what we train as doctors. We diagnose condition. We don't just people call us on the phone and say, hey, I got dry skin, give me a solution. We don't do that. This is not what doctors do. You may be able to do that through the department store, but this is not. This is really the optimum medical practice. You need to firstly diagnose. You diagnose by asking questions, you examine, and you feel, and you look. And then you come with a solution specific for that patient.
Of course. So actually, just to give a concrete answer, if you have an oily skin, open pores is due to oiliness, zinc is the best. Superoxide dismutase can be also very good.
Yes.
Niacinamide can be also the right product because it works in the vitamin B3 works in the oiliness. Then if it is more a question of open pores due to aging, if you have a sensitive skin, will be again niacinamide, madecassosides. If it is male to hormonal aging, will be more isoflavones. And if you have a fixed solid skin, and it's a retinol.
Retinol, yes.
And then we can increase the dosages. But even if you have an oily skin, while you're entering the aging process, we can still make a serum for you because this is the beauty of personalization.
Exactly. You don't have to miss out. That's the thing. No one misses out. No one misses out. Everyone's special.
This is a many ingredients without, of course, forgetting the hyaluronic acid as part of the open pores due to the skin thinning and the skin aging. Okay. Yeah. Next questions, Dr. Joesph. I have. Why can't we buy the serum at our local pharmacist?
Why? Because I say the same reason why you can't go and get your heart pills from the pharmacist without a prescription, because you need a diagnosis. I mean, this is really, we're talking about pure ingredient. They're high concentration, they're specialized, they're designed for an individual condition. And so firstly, you need to be diagnosed by a doctor. If the doctor cannot diagnose you, you can't really you don't have a reason to treat. So therefore, you need to actually someone to assess you properly, to diagnose you, so we can prescribe this protocol for you, so we can put together for you. And this is really the reason why. And like I said, the example before, it's not just a pill. Like you don't just go to pharmacy and buy any pill to fix a problem. You need someone to tell you, you have this condition and this is the solution. Go and buy this. And so the same here with Universe Skin. We diagnose your problem, and then we give you a solution that will fix your concerns. not your brother, not your sister, not your mother, your concerns or your skin concerns.
Also, from a regulatory point of view, being exclusively doctor dispensed is not only a marketing strategy; is a regulatory obligation because
yes, it's prescriptive.
It's a product and a service.
Yes.
So it's not just you get the product; you need to have a follow up. And most of the regulatory authorities, whether in Australia or whether it's Europe or the FDA, we ask us that the one that is making the diagnostic is the same that is mixing the product in order to avoid any kind of mistakes and have a better follow-up in terms of cosmetovigilance. Because sometimes we can go higher concentrations, and this is the reason also we have a platform, Skin Access, because we can really track down and we know what the patient, what was the formula, when it was done, for which reasons. And I think no other company has the capacity to fully trace each of the formulas. I mean, we make more than 2 million formulas since 2015 in Universkin, and we know each formula, where it was, who it was, because doctors they know it. And since we have Skin Access since 2017, we put it on the platform, and this platform also became a giant platform of knowledge that all the doctors can share. So I know it's sometimes frustrated that you have to be back on a clinic. Sometimes you're not close to the clinic or not close to the doctor. You have to take the car. But I know, Joesph, a lot of doctors use Universkin, they do it. You connect to Skin Access, you make your formula, then you connect with the doctor, and the doctor can ship it to your door. It's not a problem. And it's a kind of service we provide. And of course, within always the product, you have a service. You have to understand that Universkin is not just a product. It's a product and a service together. So you cannot change the product from the service. It's coming together.
It's like old-fashioned medicine. Old-fashioned medicine. This is what we always did in the past.
So next questions. I have sensitive rosy skin. What do you recommend, Joesph?
Well, look, again, I mean, when I see these questions and then people assume they're going to be just one problem, one answer. It's not like that. When people have rosy skin, you need to diagnose it. Rosy skin is a multitude of conditions. It could be just a purely vascular, that people really flush on their skin. And if this is the case and they haven't got any brown pigmentation, in a few days, you start to notice. So I was talking, you froze on the screen. I'm not sure if you heard what I said, but I said I'll use Rutin for people that have redness with no pigmentation, because Rutin is a beautiful medical product that can strict the vessel. So you see results usually within a few days. Now, if they have redness, but they also have some sunspots, you need to address that as well. You can't just ignore the sunspot and only treat the redness, because the redness can contribute to the sunspot. So we might just include a product like azelaic acid, which treats pigmentation as well as redness. In some patients, the redness could be because if they had a procedure and they end up with what we call post-inflammatory pigmentation. This is where people get pigmentation after have laser or peel, where things hasn't been done in a normal fashion, or some people respond in that fashion. So for these people, we might incorporate some vitamin B3 because of the anti-inflammation, with some azelaic acid and a lovely serum that they can really use to do it. But we can't also ignore that some people have a reactive skin and some people don't have a reactive skin. So we need to incorporate what we do for them in that regime. And then if they have a reactive skin, I might have to include something like metacosocide just to calm the skin down a little bit, and then some vitamin B3 to address it. And if their skin is really dehydrated, I might include some aloe vera. Aloe, so just to actually hydrate their skin. So it's really, there's no simple answer to any presentation that we face on a daily basis. So as a practitioner, I have to go through all this in my mind. Now, it took me years to actually learn about the skin. Like, you can't learn about the skin in one session, as you know, Harry. So we have to go through all this differential diagnosis. And as doctors, we train to do this. When we see something, we think, could it be this or this or this or this or this? And the list could be sometime 100. So you have to just work by exclusion. And then this is what we do with Universkin. We try to exclude all the other conditions to come to one condition, or maybe two, that they are existing, and we treat them in that same fashion.
Yes, but identify the dysfunctions, and no Google will give you this answer. I mean, you need someone with strong medical knowledge behind.
And then there's not one cream on the market that will have all those solutions together, because some of these solutions can be can contradict themselves. So you can't put these two products sometimes together, because they can cause a bad reaction on your skin, and then of course your skin will become worse. And then worst case scenarios, people use product without prior consultation that can cause the redness, that can cause dermatitis, that can cause.
That's exactly what I was ready to say. I see so many people, they say I have sensitive red skin. And you see a lady, phototype 1, 2, which means blue eyes, with very thin sensitive skin, using 0.5% retinol. And I say, okay, you have nothing wrong with your skin, you're just using the wrong product.
Yes, exactly. And so this is really why I think you need to see a practitioner, a doctor, to assess your skin properly on a regular basis. You don't just get a diagnosis in January and you don't see the doctor till next January, because your skin forever evolving with the season, with your lifestyle, with going through a pandemic. A lot of people's skin will be going through a lot of changes because of their high cortisol level, because of the stress. So I had to modify a lot of my clients' skin regime in this time while we're in the lockdown, because if they continue with the regular skin routine, even though they've done it before, they're going to end up with more redness. They're going to end up with more sensitivity. They break down the barrier of their skin, and they end up with eczema and then other conditions that can really occur, rosacea, etc. So it's very important to keep this communication channel open between the doctor and the client, because nothing is as steady on your body, especially on your skin. Your skin is really changed every day, and you need to pay attention to it. You know, it's just your best friend. And you need to actually keep in contact with your skin. You can't just ignore it.
I agree. And especially when we see the trends today, it's more and more no makeup, or fresh look, no makeup. Even we have makeup artists recommend makeup to look like no makeup. But
yes.
the healthy skin is the best way to achieve the no makeup look. So just to try to make the hard guess about the question 4, I have a sensitive rosy skin. So let's say, are we able, as professionals, just with 3 words, recommend an ingredient? So when I read sensitive rosy skin, most probably is a phototype, but is 1, 2, which means it's a fair skin, it's not a dark skin.
Yeah.
So sensitive rosy skin, so I don't know if it's an allergenic inflammation. This is a little bit too much. I mean, let's say crystal ball to look inside and guess what is it.
Yeah, if I was to guess, I'd probably say let's put some rutin, some medicaicide, some vitamin B3, and
exactly.
I think that kind of is a really nice, safe formula without really knowing more about the client, right?
Exactly, and it's for me, I would be even going with this level of information. I can see use niacinamide as basic of your routine, and then you can construct something upon this which is more specific to you. But if you have a sensitive rosy skin, I can say definitely avoid retinoids, avoid exfoliants, avoid vitamin C. Vitamin C can also create irritation. It's an acid. It's L-ascorbic acid. So the person that asked, I have a sensitive rosy skin, connect with Joesph. There will be a few more questions we need to know. But based on the knowledge you give to us, we can say definitely use niacinamide. But of course, you need antioxidants, you need to prevent the aging, you need a sunscreen also. So it's an incomplete answer to an incomplete question.
Yes. I mean, really, look, I think we're not saying that every time we answer a question, but it goes without saying that there's things that I call not negotiable. It's always not negotiable with me not to have a good hydration, but also a moisture, like a sunscreen. If people don't want to follow the sunscreen formula every single day, I almost refuse to treat them, because I cannot really build something if they're going to go and destroy it for me. I feel like I'm wasting their time, wasting their money, and we're not going to win. So there's certain things like you need to cleanse, you need to moisturize with the right serum, you need to hydrate, and in the morning with the sunblock, and at nighttime with the right ingredient, like whether or not it's Next Ultra 1, 2, or 3. So even though we're not repeating that goes without saying for every single client that we see, is you need to do 2 steps. You know, you can't build a good skin with just one ingredient. You know, we're talking specific now about the concerns. This is a treatment serum, but they need to follow certain steps to win. And as I mentioned before, 80% of really the benefit comes from what they do at home. And this is why I think it's important not to waste money on products that are vague, They need a product that's going to do something for their skin, because we can get them faster. We can get them there faster if we use a product that we know exactly what we're using on their skin.
And we can help them win someplace in the bathroom. Every time I see, I'm invited sometimes. This is my guilty secret, but I always go to the bathroom and I'm open to see, and I see so many bottles of cosmetics. I mean, like 10, in average, 10 to 12 bottles. And when I asked to use all this, no, this I tried once, was good, but it irritated me. The other was a friend, but it's not good enough. Finally, they have so many products, and sometimes we say, oh, it's expensive to buy this brand or this brand. And finally you see that we buy 5, 6, 7 cheap brands, and everything is make them unhappy. So finally people, they spend so much money using the wrong products. I don't say that everybody is on this category, but definitely for people, they are busy, but they want to delegate the skincare routine, but they want to do it right. It's like a dentist. Every 3-6 months, you visit your skin expert, physician, you check, you get the right prescription, and then you follow up. I mean, it's not so difficult if you can do it at distance.
And it's really, it ought to be kept simple. I always say to people, if your practitioner is trying to give you 15 products, think about it, think again, and then maybe say, go home and think about it and don't go back, because it really shouldn't be complex. You know, usually all I say is you need a cleanser, you need a serum, you need a moisturizer for the morning, and the moisturizer will have some sunscreen, or you'll have just a sunscreen after your serum. And at night time, you have the same thing. So you have your cleanser, you have your treatment serum, and then you had your moisturizer. And we can include all the ingredient in these 3 steps. So you shouldn't have to spend half an hour putting moisturizer on your face. It should be really easy, quick, so people can stick to the plan. Otherwise, they'll do it the first day.
It's up to the industry to adapt to the consumer needs, not to the consumer needs to adapt to the offer of the industry. So you have to make a product for each individual, rather try to offer 5, 6 products, but everything will cover a little bit. Let's go now to something that was interesting. You say it's a stress period, the COVID, everybody's worried. Even if the lockdown is finishing, they are still stressed. So also we see a lot of skin inflammation, dermatitis due to stress. But the fact that we have also the lockdown, okay, there is a lot of stress, as we explained, there is cortisol. Stress can accelerate the aging, so we need to think to use skin boosters in our skincare regimen. But at the same time, as you stay inside, even if I know you have a lot of sun in Australia and everybody has a garden, it's the right moment to treat pigmentation, because it's during the winter we can treat really in an efficient way pigmentation. And then we have a question, what treatment really works on face pigmentation? And this is very interesting, because it's only in south of France, in Australia, we see so heavy pigmentation cases, a lot of UV damages, melasma. And when it comes to pigmentation, what the treatment really works for face pigmentation is like you're asking a guy, advise me a car with 4 wheels. So it's so general.
Yeah, I mean, exactly. Because again, Harry, I think you know what I'm going to say. Pigmentation is not just the one condition. There's million things, there's million type of pigmentation, and there's million causes of pigmentation. And you need to consider all that, and usually get that from the history. And also, when you examine a patient, you can tell what sort of pigmentation they're dealing with. So you need to delve in and then find out a little bit more. And sometimes I'll take an imaging with a VISIA technology to actually trying to understand the extent of it. So it's not just as straightforward. And this is not something you can diagnose by talking to someone over the phone. But within our palette, if you like, of what we can provide the patient, we have a lot of good ingredient, and some ingredient that you can only get through university, like kojic acid, like arbutin, phytic acid, which is a good exfoliant and also treats the inflammation that can sometimes contribute to the pigmentation. I always include vitamin B3, because when you're using these ingredients and they're strong, you need to make sure that the inflammation in the skin is really low. I love I love the kojic acid for pigmentation, because for a while we couldn't really get that hands-on, and so it's such a powerful anti-pigmentation product. Azelaic acid is another product that comes to my mind for the right person, because it reduces the inflammation, but also it reduces the pigmentation. So it depends on their skin health, what type of skin it is. Is the skin dehydrated? I might add some of the blue element to it, like aloe vera or B5. So it depends. There is no one formula that suits everyone. Which really goes with the philosophy of why Universe Skin was put together in the first place. We can create more than 1,200 different formulas within you know, one space for our client. So it depends on what it is that they, what pigmentation they're dealing with. This is how I come up with some solution. Another product that I often use when I'm treating pigmentation is SOD. You know, it's a wonderful product. It's gentle. It's not really too harsh. So you can combine that with some L-ascorbic acid for a little bit of exfoliation. But it does irritate the skin. So you need to add some vitamin B3 again, just to sort of, you know, it's like cooking, really, like making a lovely recipe. Huh? This is what we do. Yeah, but it's also like painting with different colors.
Exactly. It's understanding the skin above all. If I can say something about pigmentation, because in university we can make more than 150,000 different formulas for pigmentation, 150,000 formulas, and still I believe we don't have enough, because pigmentation is one of the most difficult conditions to treat. But there is two things. If you have pigmentation, you want to get rid of it, there is two things you need to consider. Number one, decide to get rid of it and being religiously what your doctor is advising. Apply it religiously. If you don't do it religiously, it will not work. It will be a failure. You waste time, waste money. Better to live with the right makeup to cover it, and that's it. So, and second is sunscreen. So if you don't really, you're not ready, and you want to zap and find the miracle products, but in 2 weeks or 4 weeks, you're going to get rid of the pigmentation. If you have a kind of patients, they go to the pharmacy to get hydroquinone over the counter, or even in products that we are not even allowed to be sold. If you are the kind of person that you go and you're waiting for the last peeling to get rid of the pigmentation, I think you should start to think over about your modality, first of all, and understand that this condition is a chronic condition. And you need to stick to it. You need to be religious on it, because skin has a memory, and especially the melanocytes, they are like elephants. They have a very strong memory. And you cannot change the memory just by hitting them. It's not by punching someone that you will change the memory. So you need really to go slowly, to go safe. And then if we can make some process, it depends of your phototype, which means your skin color. It depends of your skin thickness. It depends of
You just froze on me there.
You do it for every, you do it for every patient entering your sand. I know you do this, and not everybody's doing this, but you do it, and it's great, is to check if it is an epidermal melasma, so if it is superficial or it's a deep dermal melasma. If it's a deep melasma, it's more complicated. You need to go maybe not only with skincare, but you need to go with lasers, you need to go with other treatments.
Modalities.
Yes, but you still need to prepare the skin. And so think also that melasma is just what you see. Today, all the scientific publications, in which we exchange a lot. The last time we met in January in Nice, when we came, we discussed a lot about what is beneath the melasma. Today, all the modern theories saying that is vascular inflammation. So actually, it's inflammatory process, melasma. It's not just pigmentation, is what you see. So you need antioxidants. So let's say if we take the hero actives to use of the melasma, it will be definitely to get rid of the pigment arbutin kojic, definitely to prevent inflammation, azelaic and niacinamide, definitely to exfoliate phytic, glycolic or salicylic if you are oily, definitely as an antioxidant, vitamin C, superoxide dismutase. It depends, but all this, how much you will use, how you're going to combine it, depend on the complete outcome of the skin. So we can customize it for you, but first of all, if you come to us and you want to get rid of your pigmentation, you try everything, doesn't work, do not expect that we're going to fix it in 3 months. You need to understand that it takes time, and you need to follow it religiously. Everybody gets to the destination. Sometimes some people faster, some people slower. but it is something that we don't want to overpromise because in the end of the story, we will be disappointed. The patient will be disappointed. And we know that is a path will bring us to this destination. Both parties disappointed if both parties, they don't understand what to expect and what to follow.
Yes, 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 I know. It is, I always say to people, it's a journey. Whatever we're doing for your skin, it's a journey. And that journey is not always straightforward, and it's going to go up and down and sideways and etc. But as long as we stick together, we'll get there together.
Exactly.
I need to know about what you do. You can't just divert and go to one side and do something on the side and come back to me, because what I'm planning to do for you, it might cause you harm. So you need to be open and really honest with me about these steps that we take together. And then if you had to go somewhere else, you must tell me, because I don't want to really cause you harm.
Exactly. I think we have only 3 minutes left. We didn't answer all the questions. There are so many questions.
Where did the time go? Where did the time go? I mean, I feel like I was only talking for 5 minutes.
We are passionate about skincare. That's true. But so we have maybe time for the last question, very fast. Do I need sunscreen during the colder days?
Always. As I said, not negotiable. Guys, if you're listening there, sunscreen is your savior, especially if you live in Australia. We have a hole in the ozone layer. Every single day, rain or shine, winter or summer, sunscreen is part of your regime. Because even when you're sitting next to a window, within 2 meters of a window, you actually, even if you're inside, you get in the ultraviolet A and B rays. So yes, big yes.
Joesph, we'll stop here. Thank you so much for being with us. It was a pleasure always to discuss with you.
Mine. And I can't wait to come back to Nice so we can go back to La Petite Maison, I think it was.
Yeah, I know. It's a great restaurant.
It was amazing.
It's closed for the moment due to the lockdown, but they make home delivery. They make home delivery because they love their clients.
Will they deliver to Australia? Will they deliver to Australia? Will they deliver to Australia?
That's a little more complicated, but we can deliver. We can deliver from Dubai maybe, because there is a Petite Maison in Dubai.
So, of course.
Thank you so much, Joesph, for your time. It was really a pleasure, a lot of fun. And I hope it was fun for everybody that was following up.
Thank you. I'll see you soon.
See you soon. Take care.
Ciao.
Bye.